Toy, thank you very much. Well, people in the Trussville area will soon have a new place to be seen by an emergency doctor. The Grandview Freestanding Emergency Department had their ribbon cutting yesterday, so officially getting ready to open. Now, they're not seeing patients yet, but they are getting ready to do so. Could be a week or so. Dr. Kevin Cope is the medical director there, and he joins us in studio this morning to talk about that and what they have to offer to folks living out in the Trussville area and surrounding areas. Good morning to you. I know you wanted to say something, first of all, about the helicopter crash.
Absolutely.
With the emergency crews.
You know, that crash brings to light the risk that all of our first responders take every day trying to save people's lives. And from Grandview Hospital and the Grandview Emergency Department, we just want to offer our sincere and heartfelt sympathies and prayers to the families of those who lost their lives, and then also to the crew member who's still recovering from their injuries. We appreciate their sacrifice and service every day, and all EMS service and sacrifice every day. So we just want to convey those prayers and condolences to them.
They certainly are heroes, and put their lives really on the line to take care of other people. So we'll turn now to talking about the freestanding ER. So it's not open yet, as I mentioned on the outset, but it will be open soon. What kind of difference is this going to make to you in the Trussville and surrounding areas?
The main thing with the freestanding ER concept is really to bring care to where people live. We recognize the Birmingham area is very big geographically, and being able to see a need and an opportunity for these services and bring these services closer to home for so many people is going to be great for the community of Trussville. And great for the surrounding communities as well.
So talk about the differences in this and say typically what people are used to an emergency department within a hospital.
Sure. The main difference is there's not a hospital attached to the emergency department, but even though there's not a hospital attached, this is a full service emergency department. We will have 24/7 lab. We will have 24/7 radiology imaging to include x-ray as well as CT scan. And it will be staffed 24 hours a day and 7 days a week by a board certified emergency medicine physician. And then during our peak hours, we will have our outstanding emergency medicine physician assistants and nurse practitioners staffing the department as well.
You know, we all, when someone's sick or we're sick, you might have questions about, is this to the level that I need to go to the ER? Do I need to go to an urgent care? Those are hard decisions sometimes. I guess this will make it easier having that freestanding ER there closer to people. But talk about the differences in like an urgent care and the freestanding.
Sure. Urgent cares a lot of times are not open 24 hours a day and 7 days a week. Our freestanding emergency department will be open. Urgent cares sometimes specialize in just seeing adult patients or pediatric patients. Our freestanding ER will see infants up to over 100, and we've seen several over 100-year-olds in our practice at the main hospital. So we see everybody. Freestanding ERs and ERs in general have more extensive lab capability. They also have more extensive imaging capability.
So having that, what does that do? How does that help a patient so much?
We can get immediate answers, you know, whereas urgent care sometimes have to send labs out to get answers.
So you could be needing some kind of medication, but you won't get it for a while, but you'll get it quicker perhaps.
We will have full pharmacy and basically a full ER pharmacy in the freestanding emergency department. So we will truly be prepared to take care of any medical emergency in that facility.
Like any ER, I would assume you get to a point if there's something that needs to be sent to somebody that has that specialty, or talk about the differences there.
Absolutely. With the being affiliated with Grandview and this being a Grandview freestanding emergency department, we will have access to all our on-call specialists. So if you have a condition that requires specialty consultation, we will have access to our on-call physicians to help us and then help the patient with that. If you do have a condition that we can't provide definitive care for in the freestanding, we will transfer you to the most appropriate hospital that can take care of your condition, whether that's Grandview or if you have physicians at other facilities in town, we are happy to try and arrange transfer to those facilities as well.
What attracted you to emergency room?
really, there's not a typical day. You never know what's going to come through the door. You also get the opportunity to help people really on a lot of times their worst day. You know, being able to make a difference in the lives of a patient, in the lives of family members on somebody's worst day is really something that I don't take for granted. It's very humbling because you really do have somebody's lives in your hands with the decision that you make. And I think all our physicians and PAs and nurse practitioners feel the same way. We really try to provide compassionate and competent care to every person that walks through the door, and we look forward to providing that care out in Trussville like we have been doing at the main hospital
Well, gosh,
for several years.
we can certainly tell that they're in good hands. Dr. Kevin Cope, you think a week or so it'll be open?
We hope. Best case scenario, we'll be open in the next week. If we're not open in the next week, hopefully it will be not too long after that. We're just, when we open, we want to be ready. We don't want to open just to open. We want to be, we want to open to be ready to go and hit the ground running. So,
Well, thank you for your service to the community.
well, thank you for having me. I appreciate it.